Hello, I'm Dr. Tom Nicolai. I'm Secretary General of Eurochem, which is the one and only foundation that unites and represents the whole sector of traditional, complementary and integrative medicine in Europe. That means doctors, veterinarians, practitioners and patients. I would like to show you my ideas about how we can make policymakers aware about the benefits of integrative medicine. And I will show you some slides. So, this is the title of my presentation, Towards Integrative Healthcare. You will, in the course of this presentation, understand why I use this terminology. It's about making policymakers aware of integrative medicine. You certainly know that there is quite a lot of ignorance about and bias against integrative medicine among policymakers. And we need to make them aware of what integrative medicine actually is and its potential for improving healthcare. We can start, of course, with the definition of integrative medicine. You know this definition from the Academic Consortium for Integrative Medicine and Health. It's about making use of all appropriate therapeutic approaches, healthcare professionals and disciplines to achieve optimal health and healing. In fact, integrative medicine is the best of two worlds. The world of biomedicine and the world of traditional and complementary medicine. And I would like to go a bit deeper into in what sense these worlds look like and how they use different models of health and disease and how they in fact complement each other. The biomedical model is focused on how can we combat disease. So what is wrong in this person and how can we fix it? How can we counteract it? And the treatment is about neutralizing or managing, eradicating a physical problem. It's about destroying infectious agents, bacteria, viruses, parasites, or cancer cells. And it is about blocking and inhibiting biochemical pathways. You can see from the names of the biomedical medicines, they are anti-inflammatory, anti-cholinergics, anti-epileptics. They inhibit certain enzymes, they block certain enzymes, and so on. This approach, this model, has some strength. It has been highly effective for instance, acute medical and surgical emergencies, for life-threatening conditions, for serious psychiatric conditions, for conditions with irreversible tissue damage, for conditions requiring medical technology. But this model also has its limitations, as any model actually has. It has the biomedical model has a limited ability to change the course of chronic diseases, the so-called non-communicable diseases, NCDs. And there is a need for blocking these biochemical pathways. Otherwise, the symptoms just return. So there is a need for long-term drug regimens, or sometimes even lifelong. And also other pathways are affected. So there are adverse effects in other parts of the biochemistry. And that can lead to serious adverse drug reactions. You may know that there are about 200,000 patients who die every year in the EU from these adverse reactions. And other symptoms require more drugs, leading to polypharmacy. And that is especially a big problem in the elderly. And this model does not restore patients to health and autonomy. How about the traditional and complementary medicine model? That model is focused on how can we promote health? What made this person susceptible to a disease, and how can we enhance their resilience? And the treatment is about restoring balance to the whole psychosomatic system by stimulating or mobilizing the organism's innate healing and self-regenerating capacity. And body, mind, and spirit are interrelated, must all be considered, as you know. What about their strength? The care is individualized, aimed at restoring the person to a healthier state of being, to their resilience. Can be used as an early first therapeutic option, which reduces the need for high-impact, high-cost interventions with potential adverse effects and long-term dependency on medication. And in case of infectious diseases, TNCM modalities, by their capacity to boost the immune system, can reduce the need for antibiotics and the problem of antimicrobial resistance. And these treatments are mostly low cost. So this is the strength of this model, and these strengths have to be conveyed to the policymakers. This model has also its limitations, and we have to be clear about it. These therapies can only play a secondary role in serious life-threatening diseases, because protection of life itself always has the highest priority. Then biomedical interventions are indispensable and should be given primacy. And also in the case of conditions that are too far out of balance for the self-regenerating, the self-healing capacity, in that case, medications to reduce harmful symptoms to an acceptable level can be important. So there are two worlds, the world of biomedicine and the world of traditional and complementary medicine. They use different models of health and disease, each with their strengths and limitations, and in fact, they perfectly complement each other. So there is no need to fight. So how can we make policymakers aware of the benefits of integrative medicine? It is important to make policymakers aware of the potential of integrative medicine for reducing current healthcare challenges. There are a lot of healthcare challenges at the moment. Antimicrobial resistance, the incidence and prevalence of chronic disease, polypharmacy by an aging population, soaring healthcare costs. And these are the areas where integrative medicine can play an important role. And it's about the contribution of integrative medicine to more sustainable healthcare systems, a more holistic approach to health. It can also be very useful to show policymakers what is the similarity between integrative medicine and organic agriculture. In agriculture, the use of herbicides and pesticides have to be limited to improve the quality of crops and soil. And in fact, this same principle is applicable to the treatment of humans and animals, of course. It's about lowering the use of high-impact drugs to combat disease and giving preference to treatment that promote health and the resilience of humans and animals. And that is exactly what integrative medicine offers. Showing this similarity is always very useful, then policymakers can even more easily understand. This conference is also about lifestyle medicine. Lifestyle medicine is the evidence-based approach to preventing, treating, and even reversing diseases by replacing unhealthy behavior with positive ones, such as healthful eating, physical activity, managing stress, forming and maintaining relationships, improving your sleep quality, etc. You know a lot about lifestyles, I suppose. And it is, of course, the primary modality to prevent, treat, and even reverse chronic disease. And as a matter of fact, lifestyle medicine has been a part of the integrative approach to healthcare of, for instance, Ayurveda and traditional Chinese medicine that have been practiced for thousands of years. But we can be very happy that lifestyle medicine is now becoming mainstream. People see how important healthy lifestyles are as regards their health. And there is increasing evidence that lifestyle changes actually can bring disease into remission, can reduce the disease burden and improve the quality of life of patients with chronic conditions. And also the many examples of lifestyle changes leading to remarkable health improvement demonstrate that there is a self-healing capacity in the human organism and also the animal organism, of course, that can be stimulated to regain health. And this principle is, in fact, also the basis for the therapeutic potential of traditional and complementary medicine. So this is a sort of bridge between mainstream thinking and the thinking in traditional and complementary medicine and in integrative medicine. So how do we operate when we have a patient with a chronic condition, chronic disease? The primary approach, of course, are lifestyle changes in the management of chronic disease. And we know that even some chronic disease can be reversed just by changing lifestyles. And if lifestyle changes are not sufficient, then the low-risk traditional and complementary medicine modalities come into play, aimed at stimulating, mobilizing the organism's innate healing, self-regenerating capacity. And only if that approach is not sufficient, the biomedical approach is necessary. So this framework, this idea of operating in case of patients with chronic disease is very important to convey to policymakers. While nowadays it is the biomedical approach that comes first, and then if nothing helps, the traditional and complementary modalities can be used. But it is the other way around. I would also like to emphasize a little bit more the mental health aspect. Healthy lifestyle includes, as you know, the ability to manage stress. That means, in fact, having a level of mental health and emotional resilience. And that means that a limited ability to manage stress from life challenges, in fact, are one of the main causes of somatic disease. I have listed a few of these life challenges: loss of loved one, financial crisis, interpersonal frustrations, childhood traumas, family problems, interpersonality conflicts, etc., etc. It is so important to deal with, to help people dealing with these life challenges, because they are the main causes of somatic disease. And only when patients can better manage the stress from life challenges, it will help them to regain their health. It was the first Director General of the World Health Organization who already said, without mental health, there cannot be true physical health. So psychological assistance is therefore an inextricable part of integrative medicine, and I would say not integrative medicine, but integrative healthcare. In fact, it is more accurate to use the term healthcare as opposed to a more narrow focus on medicine, because medical care is just one of many factors that contribute to a citizen's health. Integrative healthcare integrates a continuum of services: health promotion, disease prevention, wellness, health maintenance. And integrative healthcare means collaboration between health professionals to provide complete treatment to patients and improve their overall well-being. And that means that in integrative health centers, we have to include several disciplines, several professionals, from conventionally trained physicians to psychologists, dually trained physicians with skills in TNCM methods, TNCM practitioners, lifestyle coaches, nutritionists, mindfulness instructors, yoga instructors, bodywork therapists, art therapists, etc. So what do we need for TCIM to be fully integrated? We have to ensure access to TCIM. That is a part of the right to health. We have to include these services into the basic health insurance and the national health reimbursement systems. And it is important that there is reliable information on TNCM disseminated widely to help the public make well-informed choices. And another important point for the integration is the provision of high-quality TCIM care via regulation of TCIM professions and practices, including accreditation of trainings according to international standards and regulation, or licensure of all TCIM healthcare providers, and promotion of the best practice models for TCIM throughout the healthcare system. And there is a need for students of healthcare professions to learn to competently advise on TCIM. And a regulation of TNCM products through specific regulatory pathways for these products, taking into account their specific, typically low-risk profile. And last but not least, another important point is the promotion and funding of research on TNCM. So, well, this is the end of my presentation. I hope that these ideas and considerations are useful for you to get, well, let's say your own perspective on how we can make policy makers aware of the contribution of integrative medicine to the future of healthcare. So thank you very much for your attention. I hope to see you again sometime, somewhere. All the best. Bye-bye.